Hey, Future Peds rock stars, welcome back to the deep dive. Get ready, because we are about to jump headfirst into some absolutely critical intel for anyone stepping into the incredible world of pediatric nursing.
Hmm.
Think of this as your shortcut to knowing what really matters.
Hello, and yeah, we're thrilled to guide you through this essential foundation. Pediatric nursing is, it's so much more than just caring for smaller patients. It's a truly unique and, dynamic field.
That's right. Our mission in this deep dive is to pull the most important nuggets from a key source covering the foundational concepts, history, care models, and the real-world issues and trends you're going to encounter. By the end, you'll have a solid grasp of what makes peds different and why it's such a vital specialty.
Okay, let's get started. What is pediatric nursing, really? At its core, it's caring for children from birth all the way up to 21 years old. And that includes everything from, keeping them healthy, preventing illness, managing complex conditions, and helping them recover. Health promotion, restoration, the whole spectrum.
Okay, so that age range makes sense. But you said it's unique. Why can't you just treat a kid like a tiny adult? What are the big differences we need to understand right away?
That phrase, not just caring for little adults, that's probably the most important concept here. Children's bodies, their minds, they're constantly growing, constantly changing. You need specific tools, specific knowledge, their physiology, their responses, it's all different.
Different how? Give us some examples.
Well, okay, take assessment, simple things. You need specific growth charts, right?
Mhm.
And not just general ones, but sometimes tailored for specific populations, like kids with Down syndrome. We use tools like the Tanner scale to track pubertal development. It's not just about vital signs.
Right.
It's assessing growth, motor skills, cognitive maturation, language. Their overall developmental stage is crucial.
Development is key then. I remember hearing about some major thinkers in that area.
hmm
Was it EPFK? Every ped's future knows.
Yes, Erikson, Piaget, Freud, Kohlberg, perfect.
Ah, good memory trick.
And understanding those theories helps you tailor everything, how you explain something, how you give meds. A toddler perceives pain completely differently than a teenager, right? Even for the same problem. You're always thinking, how do I adapt this for their developmental level?
That makes complete sense. And here's another really fundamental concept from the source that kind of shifts your perspective.
hmm
Who exactly are you caring for?
This is huge. In pediatrics, the unit of care is not just the child. It is the child and their caregiver. You're
Mm.
caring for a family unit. Parents, guardians, siblings, they're all part of the picture. Vital partners.
Okay, let's quickly look back. How did we even get here? Because caring for the whole family wasn't always the norm, was it?
Oh, absolutely not. Historically, well, newborn care was often at home with midwives. Early hospitals could be quite stark, kind of cold and rigid. Parents often weren't allowed to visit or stay. They actually thought separation was better for the child.
Wow, imagine practicing that way today. It's hard to picture.
It really is. But thankfully, the field evolved. The first dedicated pediatric hospital in the U.S., Children's Hospital of Pennsylvania, opened way back in 1855. And education started specializing early, too. The 1917 standard curriculum included things like psychology and ethics alongside nutrition, showing a broad view even then.
And then research came along, what, mid-20th century? That really changed things.
Yes, pivotal research. It clearly showed the negative effects of separating children from their parents during hospital stays. That evidence was a major catalyst for the shift towards involving families. And pediatric nurses. They were really at the forefront advocating for these changes.
I even heard pediatric nurse practitioners were the very first nurse practitioners, all right?
That's right, a great piece of history. It shows how pediatrics has often led the way in advancing nursing practice overall. The field just kept growing, developing professional standards, certifications, specialized roles. The key takeaway is that pediatric nursing has this rich history of advocating fiercely for children and driving best practices based on, evidence.
Okay, let's zoom out a bit. The source connects pediatric health to national objectives like Healthy People 2030. What's that about?
Right. Healthy People 2030 sets these national goals for improving health across the country. It often highlights areas where the data shows we need to do better. And while these are national objectives, not just nursing actions, pediatric nurses play a critical role in helping meet them through our direct care and advocacy.
What are some specific examples from the source related to kids?
Things like reducing infant mortality, increasing breastfeeding rates, boosting childhood vaccination rates, promoting adequate sleep, and expanding access to a medical home for children. These are all national targets we contribute to.
Got it. National goals we help achieve on the front lines. The source also dives into social determinants of health, or SDOH. These are all the non-medical factors where you live, education, income, access to resources that profoundly impact health. Why are they so crucial in pediatrics?
Because children are so vulnerable. I mean, they don't control their environment, right? Their access to healthy food, the safety of their neighborhood. SDOH, like poverty, lack of quality education, or living in unsafe housing, can have these long-lasting negative effects on their health and development, effects they can't escape on their own.
That makes sense. The source uses the example of children experiencing homelessness.
It's a powerful and sadly growing example. The source highlights the significant numbers like over 106,000 homeless children back in 2020, families making up about a third of the shelter population. Think about the challenges. Constant insecurity, lack of safety, limited privacy, difficulty with hygiene, interrupted schooling, no space to play, inadequate nutrition. All of that impacts their growth, their development, their mental health.
So what's the nursing role when you encounter a child and family in that situation?
Well, first, recognizing the challenges they face and understanding that their environment is a huge factor in their health. And providing care that is trauma-informed is absolutely essential.
Trauma-informed.
Meaning, you basically assume a child might have experienced trauma, and you approach them with sensitivity, recognizing how past experiences can influence their behavior and their response to care.
Okay. Shifting gears slightly, the source points out our pediatric population is changing demographically.
Yes, the U.S. is becoming much more diverse. The source notes increasing proportions of Hispanic and multiracial children based on, I think it was 2018 data.
What's the takeaway for us as future nurses from that?
It means we can't make assumptions about a child's health risks or needs based solely on their race or ethnicity. It just doesn't work that way anymore, if it ever did. We need to assess each child and family as individuals, considering their unique background, culture, circumstances. And the source also underscores a really important disparity. Children of color are disproportionately affected by poor SDOH outcomes and are overrepresented in the child welfare system.
Which just reinforces that advocacy role of the pediatric nurse we talked about.
Exactly. We are uniquely positioned to be powerful advocates for policies and practices that actually work to reduce health disparities.
Let's get practical then. How do we actually deliver care with this understanding? The source discusses key models of care.
Right. These models really guide your daily interactions. Family-centered care, or FCC, that's kind of the foundational one. It's about treating the family as essential partners in the child's care journey.
So, dignity and respect, sharing information openly, involving families in decisions, that sort of thing.
Precisely. Then there's relationship-based care, or RBC. Think of this as FCC plus a deeper connection. It emphasizes the nurse building a relationship with the child and family during each shift, having focused one-to-one talks, really listening, understanding their concerns, and individualizing care based on that understanding. It's about fostering trust and safeguarding their well-being through that consistent personal connection.
Okay, so FCC is the partnership framework. RBC adds that deeper nurse-family connection forged over time. And the third model mentioned?
The pediatric medical home. This is increasingly important, especially for kids with complex health needs or those facing disparities. Think of it like the air traffic control tower for these kids' health.
A central hub coordinating everything.
Exactly. One provider oversees all aspects of care, but crucially, it involves proactive outreach, comprehensive planning, especially during transitions like going home from the hospital, and coordinating medical, psychological, educational, and social needs. Connecting families to community resources is a huge part of this model, too.
These models really shape how you'll work with families every day. Speaking of daily work, let's talk tech. You'll definitely be using the electronic medical record, the EMR.
Oh, yes. Future peds rock stars, you will live in the EMR. The source highlights its benefits specifically in pediatrics. It's essential for tracking data like chronic diseases, immunizations, well visits. It allows for communication without an office visit sometimes, facilitates telehealth, provides vital alerts like immunization reminders, and makes sharing results much faster.
How does the EMR help us proactively promote health?
Well, it provides reminders for providers about necessary health maintenance, like upcoming checkups or vaccines, things that might otherwise get missed. The source also had recommendations for EMR designers, pushing for better interoperability so data can move easily between systems, consistency with standards, and standardized ways to collect data for tracking health promotion activities.
So bringing all this together, what does the role of a pediatric nurse actually involve? What do you do?
Based on our source, you'll be incorporating that growth and development knowledge constantly, recognizing the physiological differences between kids and adults, providing care tailored to their developmental level, valuing and integrating the family's role, providing culturally sensitive care, and implementing those specific pediatric care models we just talked about, it's a lot.
And where might you do all this amazing work? Where can peds nurses work?
Oh, the possibilities are vast. From the bedside in acute care hospitals to managing units working in hospice, surgical centers, ambulatory clinics, home care, schools, camps, public health, research pediatric nurses are needed pretty much everywhere kids are.
And for those aiming higher, advanced practice.
Yep, advanced practice roles often require a master's or doctoral degree. Think pediatric nurse practitioner, PNP, clinical nurse specialist, CNS, nurse educator, or researcher.
And tell us about certifications that's like getting extra badges of honor, right?
Yeah.
Proof of expertise.
Absolutely. Certifications show you've got specialized knowledge and commitment. The source mentions examples like NRP for neonatal resuscitation, PALS for advanced life support,
Yeah.
CPE for emergency nursing, CPN for general pediatric nursing, CCRN for critical care, and CNEP for sexual assault nurse examiners focused on pediatrics. Getting certified in an area is a great way to deepen your expertise.
Okay, let's look at the landscape. What are the big issues and trends you'll be navigating as a peds nurse, according to the source?
Well, it lays out some significant ones. First, the ongoing nursing shortage. It impacts pediatrics, too, sometimes meaning kids who need home care nurses have to stay in the hospital longer, which isn't ideal.
And research has unique challenges with kids. You mentioned that briefly.
Definitely. There's a need for more pediatric nurse researchers, for one. And ethically, it's complex. Children aged 7 and up need to basically agree to participate in research, even if their parents consent. And they can withdraw any time. Caregivers might hesitate to enroll a sick child. Plus, getting a diverse group of participants can be tough, meaning research findings might not apply well to all kids. It's a really important area.
What else is on that list of issues?
Ensuring continuity of care for chronically ill children as they move between hospital, home, and school. That transition piece is huge. Communicating effectively with increasingly diverse family structures, blended families, grandparents as caregivers, foster families, LGBTQ plus parents, adoptive parents. It requires sensitivity and awareness. Health education challenges like dealing with low health literacy or language barriers, and the constant impact of healthcare costs and insurance on families' ability to actually follow treatment plans.
Okay, moving to trends. The source highlights shifts reflecting broader societal changes in health patterns. What are the ones that really stand out for future nurses?
We're seeing increased mental health needs in children, sadly. That's a big one. The rise of antibiotic-resistant organisms is, frankly, scary. There's more focus on safety education, covering things like online risks and bullying. We're admitting kids to hospitals sometimes because their home environment isn't safe, or their caregivers lack knowledge about managing complex needs, or they lack primary care access. Earlier puberty onset is a trend we're seeing. Also a stronger shift from just treating illness to focusing on health promotion and prevention, like through school health programs.
Any other big trends mentioned?
Yeah, more family involvement in care, that's a positive trend. More kids needing high-tech home care, rising prevalence of conditions like autism and depression, and significant increases in childhood obesity, hypertension, diabetes, and asthma. Plus, an increase in youth openly identifying as LGBTQ+.
Let's double-click on two of those, starting with childhood obesity. The source gives some stats, right?
Yes, it's prevalent around 18.5% in kids aged 2 to 19, with higher rates noted in Hispanic and non-Hispanic Black children. And it's not just about weight. It significantly increases risks for serious adult diseases later in life, heart disease, diabetes, and has major psychosocial impacts like bullying and low self-esteem.
So what's the nurse's role here? What can we do?
It's multifaceted. Promoting healthy nutrition and physical activity is key, obviously, but also providing guidance and support to families struggling with this and advocating for healthier environments, especially in schools, things like better lunch options, more PE time.
Okay, another critical and growing area the source highlights is caring for LGBTQ plus youth.
Yes, this is becoming an essential competency for all pediatric nurses, really non-negotiable. The source emphasizes understanding gender identity as distinct from biological sex assigned at birth and recognizing that these youth have unique health needs that providers might historically have been uncomfortable addressing, unfortunately.
What does providing good care look like for this population? What should nurses focus on?
It means protecting their rights, providing care that is non-discriminatory and truly inclusive, using correct names and pronouns for starters. It involves assessing for key risk factors like depression, suicide, substance abuse, bullying, and violence, which are sadly higher in this population due to stigma and lack of support sometimes. It's about supporting their families, too, providing anticipatory guidance and comprehensive sexual education, including HIV prevention, and being knowledgeable about gender-affirming care if that's part of their health journey. Always following evidence-based practice and considering the impact of stigma.
That's a lot to be mindful of, but so vital for providing compassionate and competent care.
Absolutely. Competence in this area is no longer niche. It's becoming a core skill for any pediatric nurse dedicated to caring for all children and families.
So how is education and research keeping up with all these changes and trends? What's happening there?
Well, pediatric nursing education is definitely evolving. Programs are integrating more multicultural care and family theory, weaving growth and development concepts throughout the curriculum, providing diverse clinical experiences, and really emphasizing health promotion and community health.
And simulation is a big part of that now, right? Little hospital insight. Simulation is your friend. Use it.
It really is. With fewer traditional clinical sites sometimes available, simulation offers this crucial space to practice complex scenarios, critical thinking, communication, all in a safe environment before you hit the real unit. On the research side, there have been some game-changing laws passed since 2007, the Best Pharmaceuticals for Children Act, BPCA, the Pediatric Research Equity Act, PREA, and the Pediatric Medical Device Safety and Improvement Act, PMSIA.
And these laws basically say, hey, you actually have to test stuff on kids if it's intended for kids, not just guess based on adult data.
Exactly. Before these laws, so many medications and devices were approved based only on adult data. Clinicians had to guess dosages or use things off-label, which isn't ideal. Now, these acts require testing in pediatric populations if the product is likely to be used in children. This is huge GE for ensuring the safety and effectiveness of drugs and devices specifically for kids. The source even mentions examples like duloxetine and lurasidone being approved for pediatric use, thanks to these laws requiring the studies.
That's such a critical step forward for patient safety in pediatrics.
Okay.
Okay, finally, as future peds rock stars, where do we go for reliable information when we need it? Where are the good resources?
The source lists some fantastic ones. For national data on child health, check out sites like Child Stats or the CDC Wonder database. For evidence-based practice, look to specific pediatric nursing journals or online resources like Bright Futures for Well Child Care Guidelines, the Agency for Healthcare Research and Quality, AHRQ, the FDA website for medication info, the National Institute of Child Health and Human Development, NICHD, the National Institute of Nursing Research, NINR, or the Immunization Action Coalition for vaccine details. Lots out there.
And don't forget the professional organizations. They're key too.
Absolutely. Organizations like the American Academy of Pediatrics, AAP, the Society of Pediatric Nurses, SPN, and the National Association of Pediatric Nurse Practitioners, NAPN, APM, are invaluable. They offer guidelines, education, networking. Bookmark these now. They'll be your go-to spots throughout your career.
Wow. Okay, we packed a lot into this deep dive. We cover the heart of what makes pediatric nursing unique, its history of advocacy, the impact of the world outside the hospital walls like SDOH, crucial care models focused on the family, the role of technology, what you'll actually be doing day to day, and dove into some major issues and trends you'll face, like obesity and caring for LGBTQ plus youth.
And we touched on how education and research are evolving to support this incredibly complex and vital field. It keeps changing.
Yeah, and remember, this isn't just theoretical stuff you learn for an exam. These are the real challenges, the real opportunities, and the foundational knowledge you'll need on the floor, in the clinic, wherever you practice.
Understanding this landscape is truly the first step to making a real difference in the lives of children and their families.
So here is a final thought for you to ponder as you move forward. Considering the increasing complexity of children's health needs, the rise in chronic illness, mental health crises, the undeniable weight of social determinants, how will you personally embrace the necessary advocacy role that is so deeply woven into the fabric of pediatric nursing, especially given the ongoing nursing shortage? Something to think about.
It's a question that will definitely shape your practice and your career.
Thanks for joining us on this deep dive. It's a tough but incredibly rewarding path you're choosing.
Best of luck as you embark on it. You can do this.
Catch you in the next one. You've got this.